Dry eye disease is much more complicated than you may think. On this episode of OCuTALK, we'll be speaking with Dr. Faheem Inayatali about dry eye, new treatments, evolving technologies, and here's some very interesting first-hand cases. Dr. Inayatali?
I want to talk to you.
Not now, later.
No, now.
Hello, everyone, and thank you for joining us for a brand new episode of OCuTALK. My name's Nick, and today we have a very special guest joining us from Eye Center of Houston in Houston, Texas, and the Dry Eye and Specialty Center in Sugar Land, Texas, Dr. Faheem Inayatali. Dr. Inayatali, thank you so much for joining us today.
Hi, thank you for having me.
Excellent, and thank you for being here. We know how busy you are. So before we get started, Doctor, do you mind letting us know a little bit about your background and your specialty?
Yes, absolutely. So my background is after attaining a doctorate in optometry, started to see patients, started to develop some specialties that I became very keen on. Went to business school right after that and got a sense for how healthcare management really plays a role especially in our culture this day and age. Utilizing that platform, was able to venture out, open a nonprofit organization, really get a chance to bridge the gap with our healthcare system a little bit more. A couple years later, after realizing that there's more to it than just what's perceived, I wanted to become a little bit more of a global ambassador for myopia management, really taking care of children and specifics on dry eye disease. So started gaining a little bit more traction in specialties. So I applied and got in for the Master's of Public Health program at Harvard. So currently working on how we can set up a clinical trial, diving even deeper into the dry eye disease and spectrum.
Excellent. Awesome. Well, thank you for that, Doctor. Appreciate that. And Dr. Faheem, you recently opened up the Dry Eye and Specialty Center in Sugar Land, Texas. Can you tell us a little bit about your practice and the services that are available there?
Absolutely. So I still practice with routine eye care at Eye Center of Houston, fewer days out of the week. A couple of days out of the month, I volunteer at IB Encina Community Clinic, serve those patients who just can't afford any type of eye care. And then the rest of my time, I spend at Dry Eye and Specialty Center about 3 to 4 days a week. And what the purpose of it is to have more of a concierge setting, have a hospitality where patients feel like they get a little bit more of my attention, to further diagnose dry eye disease, to be able to take care of children's myopia issues that are becoming more of an epidemic. And just that time spent is really to create more of a tailored, customized treatment plan for patients and get to the bottom of their condition. A lot of times dry eye disease goes undiagnosed. It's often misconstrued with other ocular surface diseases. And this gives us a chance to get down holistic with it. And whether it's taking their blood work or looking out for Sjogren's syndrome or really digging deeper, Dry Eye and Specialty Center was born to serve those patients that need that extra attention to be able to restore their lives and their eyes.
Well, excellent. That's excellent information, Doctor. What specialty cases do you most often see?
So I noticed that there's a certain segment of individuals who are just treated with eye drops for their dry eye disease. And while that does work on more of the mild cases, I realized quickly that there are patients out there that don't get that traditional relief that people are kind of accustomed to. And that was one of the reasons why I wanted to dig a little bit deeper and offer treatments that is a little bit more extraordinary. It's a little bit more cutting edge. Even with Dry Eye Center, we get a chance to spend that time and create a treatment plan. But not only that, patients tend to refer others who have similar conditions. And some of the cases that we've seen is after they get LASIK or if they have a corneal condition known as keratoconus, this provides an opportunity for them to seek out a way to get their everyday lives going again, whether it be on the computer for 7-8 hours a day and their eyes just tend to water or dry up. Scleral lenses is part of our interesting cases that we see all the time. And it's a custom fit process and protocol that allows patients to wear their lenses all day and have that fluid around their cornea, kind of bathing their cornea and giving a chance for it to stay hydrated.
Excellent. That's awesome information, Dr. Faheem. And Dr. Faheem, like listening to you and reading about you, it sounds like you have a lot of interests. Is there one in particular that's your favorite that you're really passionate about?
Right. I can honestly say when we're able to, one that's near and dear to me is myopia management. Growing up, my eyesight was terrible. I became more nearsighted by the year. And to be honest, even in graduate schools, I was still becoming more nearsighted at that point. As a result of that, my retina is a little bit thinner than the average. I'm more prone for detachment, tears, and holes. So that is very near and dear to me. Being able to treat children as young as 5-6 years old with either medical management or specialty lenses, and to not have a high prescription, which means a longer eye. And to not have that debilitating effect later on in life is extremely rewarding. Parents, you can survey around. 99% of parents don't realize that there is an opportunity to prevent their children's eyesight from getting worse each year. So having that global perspective, kind of taking a step back and realizing how much there needs to be education delivered to pediatricians, to parents, to general doctors, how much education that needs to be delivered is extremely intriguing to me. And that's one of the reasons why I want to run a clinical trial and everything else. I want to be able to have those credentials to be able to go out there and just educate the public.
As a parent of a 5-month-old myself, that's excellent to hear that you're giving back and taking good care of all these children. So that's amazing. That's amazing to hear from me.
Congratulations.
Thank you. Appreciate it. And is there any like interesting cases that you can tell us about? Because I know you've probably dealt with a bunch of cases before. Is there one in particular that you have a really interesting case? I think our viewers would love to hear about it.
So I have 2 cases for you. One was two individuals. They were twins, and they basically both had LASIK surgery in late 20s. And both patients came to me for their routine eye care, but one did absolutely perfect. 20/20 vision, no complications, everything was fine. Second one had a very debilitating dry eye issue that started reoccurring. And she was very dependent on eye drops, warm compresses, kind of all of the basic things that she was trying, but did not seem to have any type of relief. And it was interesting because both of their cuts were very similar, and everything was genetic wise, obviously very similar as well. But they had very different outcomes. And the patient who had debilitating symptoms, she really wasn't able to work, stay on the computer for very long at all, even had trouble sleeping at some point. So she was tested for Sjogren's and everything else. Everything came negative. But what usually happens with LASIK is, while it's a fantastic procedure for correcting vision, sometimes there are consequences that come with it in terms of when you cut the actual cornea. So the eyes don't send the nerves don't send those same signals that they usually did in the past. And therefore, they end up either producing less fluid. And if you already have mild dry symptoms to begin with, you can frequently exacerbate those. So I found it very interesting to see that set of genetics in my chair and have such different outcomes. For the patient that had debilitating symptoms, we treated her with LipiFlow and IPL, and those symptoms that were kind of dormant on the forehand was eventually treated, and then she was able to kind of get back to how she usually lived her life. But she described it as having maybe 10 or 15 eyelashes in her eyes all the time, and that's a very frustrating thing to have to deal with. And there are psychological issues that come with that. There are suicide cases that come with that. So it's important to reach these patients as quickly as possible and to get them treatment. The second one was actually one of my favorites. He traveled 8 or 9 hours by bus to come visit us. He saw our reviews online. He saw our services, his parents did, and they brought him because he had advanced keratoconus, and he was so young. But he ended up having to drop out of football, which he loved so much. And he had to start homeschooling. He couldn't be with the same setting that he was usually with, but it just progressively got worse. So he saw our reviews and saw our services online, decided to pay us a visit, and we were able to fit him in custom scleral lenses, got him from 2200 to 2030, able to get his life back, be able to join football, rejoin school and everything else. And he was just so ecstatic, and it was so heartwarming. And mom was in tears, and it was just such a phenomenal experience. Those types of stories drive me, and they propel me to keep looking and seeking out for more answers. And the clinical study that I'm trying to eventually have published at Harvard has to do with dry eye treatments in conjunction with nutritional therapy. So I want to know more. I want to know of options that may not have been available in the past, or at least haven't been studied extensively in the past. So I'm really looking for more answers, because these types of stories they're so heartwarming.
Yeah, definitely. Listen to that. That actually warms my heart. Like that's amazing to hear that they would travel that long to see you, but you're the best. So of course they would come out to see you that long. That's amazing. Doctor, and as want to talk about it a little bit more, you also have a nonprofit, I Give Sight. Do you mind telling us a little bit more about that as well?
Sure. So Eye Center of Houston is in a community where they needed it the most, I feel. And it's an indigent area, Medicaid, Medicare, about 60 to 65% of our practice. We made it a luxurious setting with a very warming welcome at the front desk, and all of our staff are smiling and just ready to help. And that was designed, again, to be able to serve the community that didn't have that type of high level eye care before. We have all the cutting edge technology to detect glaucoma, treat glaucoma, macular degeneration, and whatnot. But I realized that there were still some patients who didn't have either social security numbers or just fell off the grid, and they weren't able to really, get any type of eye care. They didn't qualify for anything, even the gold card. They tried all of their routes. I felt the need as a responsibility to be able to figure out a way to give back to these Houston members. So I founded I Give Sight using any type of knowledge gained at Rice, at business school. And I was able to create an organization that is becoming more and more self-sustainable as time goes on. But basically, it's a $10 donation from any individual who'd like to. They get an immediate text message that we appreciate your funding, and we look forward to the next steps. We offer vouchers with serial numbers that we give to school nurses, to churches, different places where they can vet patients and actually make sure they have a financial need and give these certificates out to. That patient then is able to bring that voucher to us. They get their eye exam, their pair of glasses, and if they do need any additional medical testing, that's covered with the voucher as well. And then after they get their pair of glasses that they're able to put on, with their consent, we take a picture, or we at least send a text message, and the donor automatically gets that text message, being able to depict their contribution to another human being, and to be able to immediately get that feedback of how big of a difference that person has made in someone else's life. So it's been a great success. Very, very happy about I Give Sight. Part of our profits go to the organization. So anybody who buys glasses at Eye Center of Houston, or if they have a treatment done at Dry Eye Center, part of that proceeds go to I Give Sight, and they're able to continuously fund the organization, provide more care to those who didn't actually have a chance. And it really changes the trajectory when a child doesn't have, or even a parent, even a adult, if they don't have a pair of glasses, you honestly can't function to even the best of your ability, or sometimes not at all. So this gives that opportunity, I think, for Houstonians and Texans to really get a chance to be able to have a different shot at life. And now we're setting up scholarships. We have our first one coming up here in a few months. We have essay applications, creative videos, and whatnot, and we offer 2 to 3 scholarships per year from I Give Sight. that allows more opportunities. And I think that's what it's all about, is to be able to grow, to be able to have success, and to be able to give back and contribute back to society.
Definitely what it's all about, giving back, and very honorable, Dr. Faheem. And if you haven't had it taken a look, take a look at iGive's site. Are there any new technologies or any new developments that are on the eye care horizon that we should be on the lookout for?
Absolutely. So I think that there are two I'd like to highlight. In terms of the dry eye world, I think that the new intense pulse light therapy is something I'm very excited about. They just released a new platform called the Stellar. We are the first in the world to be able to, fortunately, bring that in our office as an eye care office. And that is something where it's amazing how you can restore the meibomian gland function with that low level light therapy. Patients have so much relief by the first and even second treatment that it's something that you need to give it a shot if you haven't, if you're experiencing dry eye. So in the dry eye world, the IPL is going to serve a grand purpose for being able to restore the ocular surface. In terms of scleral lenses, I'd like to highlight some technology that we're waiting for. It should be arriving in our office in the next few weeks, but we're looking for what's called profilometry. And that is basically custom scleral lenses based off of the contour of the sclera, which is the white part of the eye. See, scleral lenses don't sit on the cornea, they sit around the cornea. And you have to have a pretty tailored fit to be able to have comfort throughout the day, as well as maintaining the health of the eye. That fluid that goes in the scleral lenses, they match the pH of your cornea. Some even have electrolytes. So they bathe the cornea, so it can actually serve the purpose of helping an irregular cornea post LASIK or keratoconus, but it can also help with dry eye as well. So that's why we were able to entangle both of those services within our practice, because they actually can go very hand in hand. But that profilometry, what it does is it creates a very nice seal from the lens to the white part of the eye called the sclera. Having that custom fit is what is basically like 3D printing essentially for the sclera. And having that lens makes it more comfortable. There's less visits for the patient, less hassle. I am extremely excited to utilize that technology for our patients, and I know that they'll be able to have not only crystal clear vision again, but they'll also have that comfort that they can wear their lens anytime, any place, for however long they want to wear it.
Well, that's awesome. I like the analogy of the 3D printing for the scleral lenses. Definitely be on the lookout for those new developments. Thank you for Dr. Faheem. And before we wrap up here, was there anything else that you wanted to tell our audience about?
You know, we I'm just so grateful to be here. You know, we have a nonprofit that we're constantly trying to get the word out to make a big difference in people's lives. And same with these services that we have at the Dry Eye Center. I'm so passionate about being able to change lives.
Well, Dr. Faheem, we're so happy that you're out there giving back to everything and everything that you do for your community. You're doing such an amazing job and amazing work. And everyone, that's Dr. Faheem Inayatali with Eye Center of Houston in Houston, Texas, and opening up soon the Dry Eye and Specialty Center in Sugar Land, Texas. Dr. Faheem Inayatali, thank you so much for joining us.
Thank you for having me. It was an honor.